Hello, my name is Pam Gibson, and I want to welcome you to our webinar on how to submit a case for the ASC case study portion of the ASC website. I'm the chair of the ASC Case Study Committee, and I'm coming to you from the Lerner College of Medicine at the University of Vermont and the University of Vermont Medical Center in Burlington, where we finally have seen spring and we have gorgeous blossoms and early spring flowers. I'd like to have my colleagues introduce themselves. First, Dr. Vohra.
Yeah, hi. My name is Poonam Vohra, and I'm associate professor at UCSF, University of California, San Francisco, and I'm a proud member of Case Study Committee. Now giving it to Dr. Saremian.
Hi, I am Jinous Saremian, Vice Chair of the Case Study Committee of ASC. I'm an associate professor at University of Florida, College of Medicine, Jacksonville.
Thank you, Dr. Vohra and Dr. Saremian, for joining me for our presentation. Today, we're going to show you how easy it is to submit a case to our committee for review to eventually be posted on the ASC case study website, which is one of many CME opportunities provided to the ASC community for your lifelong learning, recredentialing, and annual competencies. At the completion of this activity, you should have a better understanding on how to develop a case for submission, how to navigate our website, and you might even start thinking about who you'd like to work with on submitting a case for consideration by the ASC Case Study Committee. We'll be reviewing the steps in the submission process. One of the first steps we hope you'll consider is to identify collaborators who could work as a team in developing the materials for the case submission. Next, we want you to consider the type of case to submit for this continuing education opportunity for your colleagues. We're looking for classic examples of cytopathology findings, as well as unusual, challenging cases that you think would provide a good learning opportunity for your colleagues at in the ASC community. We're also interested in cases in which there's additional learning opportunities related to quality assurance that would be instructive for others in the community. It's important to review the components of what's needed for submission prior to writing the case and taking the images. That way you'll be more efficient when developing the case. We'll review how to navigate the submission requirements on the website. In addition, we'll briefly discuss our committee's review process. And finally, at the end of a successful submission and posting to the website, we want you to remember that you can add this scholarly activity to your CV. You might be asking yourself why I might want to submit a case to the ASC for publication on the website. This is a great opportunity to share important lessons from clinical practice, as many of us find increased professional fulfillment in sharing what we've learned from difficult and challenging cases. It's also important to take this opportunity to provide continuing medical education for our community members. And it's a great opportunity to get professional enjoyment from collaborating and mentoring with colleagues at your institution. As I already mentioned, you can add this to your CV under other scholarly publications. One of the initiatives this year for the ASC is to increase mentoring and collaboration within our community. Although you can always submit a case by yourself, it's a great opportunity for cytopathologists to work with others in our community, our cytotechnologists, our cytotechnology students, cytopathology fellows, pathology residents, and other cytopathologists when submitting a case. Now, Dr. Vohra will show you how to navigate the website submission process.
Thank you, Dr. Gibson, for giving me the opportunity. The steps to submit a case study are easy and quick. Actually, I recently submitted a case study and it was pretty smooth. What I did, I put all the information in a Microsoft Word document and just copy pasted everything. For example, clinical history, differential diagnosis, and reference, etc. So let's start. To start the case study submission, use the URL cytopathology.org to log into ASC website. Once logged into ASC website, move your cursor to the Education tab on the top navigation bar, and then scroll down to Case Studies and click on Submit a Case Study, which will bring you to the main case study page. And to start the submission, click here to submit case study information. And now you're on page 1, which has presenting authors information, starting with first name, last name, credentials, email address, institution, and address. Then enter and add an additional author or authors. Please fill out a box below and include name, institution, email address of each author. Please note that there is no number limit to add additional authors, and you can add as many as you want. After entering all this information, click on Next, which will bring you to page 2 with social media consent. ASC would like your consent to use the images from your case study on ASC's social media platforms. Select either grant or decline, and then click on Next, which has disclosure requirements. Select yes or no if your case study includes discussion of any commercial products, and then acknowledge responsibility to disclose. After that, click on Next button, which will bring you to page 4. Please select yes or no to any financial conflict interest you intend to discuss. Clicking on Next button will bring you to page 5. Page 5 has case study information starting with the title, followed by competency, area or areas addressed by your case study. Please select all that apply. Scroll down and select the topic or topics that your case study covers for the ease of searching and organizing. Next, on page 5, you will be asked to enter educational objectives. List a minimum of 3 objectives, but no more than 5. And this is followed by information about professional practice gap and educational needs. Fill in the reason why the professional practice gap needs to be addressed and state the educational needs. And in my opinion, the basic difference between practice gap and education needs can be settled. But try to define the practice gap by determining what it should be and what it is. And then fill the gap by addressing whether the gaps is due to lack of knowledge, competence, performance, protocols, or guidelines. Lastly, on page 5, please state what this CME activity was designed to change in terms of learners' competence or performance or patient outcomes. At the bottom of the page, click on Next. Now you're on page 6. Please submit at least 1 pre-test image, but you can submit up to 6 images. Label them numerically, and the images must be JPEG format. Image legends should include specimen type, stain, power, and description of images. Click on Next. And now you're still on page 6, which includes clinical history and case diagnosis. After adding clinical history, add 1 correct diagnosis in the upper box and at least 3 incorrect answers in the lower box. And then click on Next. On page 7, add post-test images and again submit at least 1 or up to 6 images, and other requirements are similar to as we discussed for pre-test images. As you move down on page 7, enter a short description of the cytologic features presented in the images, followed by discussion, differential diagnosis, and references in their designated boxes. click on Next. And now you're on page 8, which is the last page. And as I mentioned, this is pretty simple and effortless. So now you're on last page, which has knowledge-based questions. Submit at least 4 to 6 knowledge-based questions and multiple choice answers. They should be taken from the discussion section of the case you're presenting. Each question should be relevant to the case presenter and constitute the case discussion. Questions should be followed with 1 correct answer and at least 3 incorrect answers. Please note that none of the questions may be true or false, and none of the answers may be above all of the above. Each question must have a brief discussion with pertinent references. And then you're almost done, except you just have to click Submit button and you are all done. Please let us know if you have any questions and you want to reach out to how to submit case study. But now I'm going to hand over this to our next speaker, Dr. Saremian.
Once your case is prepared, submit it to ASC website at cytopathology.org/page/submit-a-case-study. Cases are reviewed by committee members and chair or vice chair of the committee. Cases are selected for review based on their learning opportunity and the strength of written content. Committee review may take up to 3 weeks. Authors will be contacted through email about case acceptance and need for edits or possible rejection. Authors have 2 weeks to respond to requests for edits. Final review will be done. Cases are placed in queue for release to the website. It may take a few months, depending on the number of cases submitted in any month. Images from the case may be used on social media once the case is added to the website. Next step, go to the link for written instruction. As we mentioned before, cytopathology.org/page/submit-a-case-study. Talk to your colleagues about submitting a case. Set up a time for your team to meet. Pick a case and decide how you will divide the work. If you have any question or concern, please contact Joanne Jenkins, the ASC Finance and Online Education Manager, or members of the ASC Case Study Committee. These are the ASC Case Study Committee members. Thank you for your attention.
Thank you for watching our webinar, and I'd like to thank my colleagues and Joanne Jenkins for helping us with our presentation today. I hope you'll consider submitting a case.